The context of this screencast is to continue where we left off in our last in-class lesson. We left off discussing Chapter 11, the physiology of the heart activity. So as a reminder, we left off talking about the two phases of heart activity, both diastole and systole. We talked about diastole being the relaxation phase of the heart, and you can see how the valves are open during this period of time, and the systolic phase where we have the contraction of the heart activity. Along with how the heart has its two phases, we also have to have an electrical conduction. In Chapter 10, we covered the nervous system, where we looked at how so much of the body's systems and processes are dependent upon electrical transmission. The heart is not immune to this, and in fact there's several nervous structures within the walls of the heart that actually regulate the heartbeat. From an electrical standpoint, the sinoatrial node, located in the upper portion of the heart, is a bundle. A node is basically a bundle of tissue. In this case, it's a bundle of nerve fibers that literally sets and regulates the heartbeat, or the two phases of the heart activity. The sinoatrial node, or knot of tissue, sends out a message. As you can see, there's extensions or nerve fibers that extend from the sinoatrial node into all the different areas of the heart. So the sinoatrial node sends a message that then gets received by the atrioventricular node, or the AV node, and that node transmits the rest of the electrical message to the rest of the heart. Without this electrical transmission, the heart would not be able to conduct those two phases, systolic and diastolic activity, and this is one of the reasons sometimes people will require pacemakers, because there's something wrong in one of the stages or one of the transmissions through the heart. A lot of times people have trouble right in this area right here, where the bundle of His, not the bundle of His, is actually found, and oftentimes the message goes from the sinoatrial node to the atrioventricular node, but with these neural pathways, somehow the message gets jumbled. So some people will have what's called a bundle branch block, and that means one of these communication channels does not conduct the sound or the nervous waves effectively. Again, another reason why somebody may require to have a pacemaker. That basically concludes the anatomy and physiology of the heart. Our next step is to kind of look at the terminology and how it applies to this system. I believe in our last class we were talking about ECGs or EKGs and how they measure the different waves, with each wave measuring the electricity that we just looked at a slide before. We also touched upon blood pressure, and blood pressure being the measurement of the two phases of the heart activity. Here's a typical sphygmomanometer, and this is the instrument that is used to measure blood pressure. Of course, we use the sphygmomanometer to apply the blood pressure cuff. We also use a stethoscope when we're listening to the sounds produced and that are measuring the two phases of heart activity. In Anatomy 2 and clinical procedures, we will be practicing blood pressure procedures. Again, moving forward, here's the vocabulary that surrounds the cardiovascular system, and some of this we've already touched upon, such as the aorta, the arterioles, the arteries, the atrioventricular bundle, the AV node. These are all common terms that we have touched upon in some capacity, and I encourage you to review this page in your book. Moving directly to the terminology, there's some combining forms I want to point out to you that maybe you may not use in other systems, like angio, meaning vessel. So whenever we're talking about a vessel, it does not necessarily have to be a blood vessel. We use angio. Artero or arterio, as we've talked about before, relates to the artery. Athero refers to a plaque or fatty substance that builds up within the walls of a vessel. So for instance, atherosclerosis would be a hardening of a blood vessel or a vessel due to the fatty-like buildup. Brachial we talked about when we spoke about the brachial artery. So each artery and vein has a specific name, and the brachial artery is in the center of the hand, of the arm. As you bend the arm forward, you can actually feel it. Again, moving further, I'm not going to talk about each one, but coronal or coronal means also heart. So that's just like we know cardio. Coronal is a less used term related to the heart. Cyano we've talked about before, which refers to blueness or bluish discoloration. Oxo refers to oxygen. And one of the important things to remember when we're studying the heart is rhythm or rhythmio. This really is something that we talk about all the time when we talk about a normal sinus rhythm, as the heart fluctuates between its two activities, diastole and systole. So somebody who would be suffering from a problem with their rhythm of the heart, we often say there's an arrhythmia that has occurred. Sphygmo, and that's where the term comes for the blood pressure measurement cuff, means pulse. So sphygmo is a combining form that means pulse. Moving further down our content here. Here are the pathological conditions as they relate to the heart. So as I was saying a minute ago, arrhythmia means rhythm. So an arrhythmia would be lack of rhythm or an abnormal rhythm affecting the heart. Some people will have different arrhythmias presented depending on what's causing the problem. For instance, somebody may suffer from bradycardia, where they have the slowness of the heart, or the electrical transmission is not at a steady pace, and the heart slows down in response to that. One of the reasons, again, why somebody may require a pacemaker. A flutter, a rapid but regular contraction, usually of the atria. The heartbeat may increase exponentially, but it doesn't necessarily mean the heart's in a serious situation, but it could be electrically driven that's causing the extreme contraction of the atria. And they say the atria could reach a contraction of 300 beats per minute with a flutter. So somebody will just genuinely feel something going on, and they will present and look for assistance because they're going to feel this pressure in their heart. They're going to feel uncomfortable. But again, sometimes the root cause can be something that they have ingested, something that's caused a sensitivity within the heart. It doesn't necessarily mean it's a permanent condition that's causing it. Fibrillation is very rapid but inefficient, irregular contractions of the heart. This happens when somebody is taking the blood into the heart, but the rapid and the random contractions is really not pushing the blood out at the same rate that the blood is coming in. It can cause somebody to go into a cardiac arrest because the heart is not circulating and pumping the blood as required. Of course, they will check into this. They would do different types of tests that could be performed. One of the tests would be a stress test on the heart, where they actually measure at what point somebody's heart goes into fibrillation in terms of how it's reacting and how many beats and the ineffectiveness it's achieving. Congenital heart disease is any abnormality that appears in the heart at birth. So this could be anything from teratology of Fallert. This is where there's different holes that are found in the heart. A lot of children with Down syndrome have congenital heart disease as a component of that condition. Some of them are operable and some are not non-operable. Coarctation of the heart. This is an example of a congenital defect that occurs where the arc of the aorta is greatly curved and in fact narrowed. They can often go in and surgically repair this with an anastomosis or a new opening or stretching of the aorta. You will see in this diagram an example of the coarctation. You can see the narrowed wall that occurs versus how it should normally have a flow such as this. It often can be surgically repaired. Septal defect. I think we talked about this when we were talking about the walls that make up the wall of the heart or the structure of the heart. And a lot of children or people in general will have small little holes that affect the communication and the transference of blood. So blood will sometimes squirt between the two holes. And in most cases, it doesn't have a serious consequence, but in some cases, it can cause severe circulation problems, and they would have to go in and do surgery. Here's an example of teratology of Fallard, as I was referring to a moment ago. This is a congenital malformation of the heart involving 4 different heart defects. Congestive heart disease, this is when, congestive heart failure. This is where the heart is unable to pump the required amount of blood. The blood will pool into the heart, and we have a heart muscle problem that creates this inability, and when this occurs, oftentimes the person will go into heart failure because the blood is filling and filling and filling and pooling, and oftentimes it pools into the lungs as well. So the person will experience pulmonary edema. This can be a life-threatening situation without medical intervention. Coronary artery disease, this is where the arteries within the heart are diseased. We often refer to this as CAD or CAD, and it's a disease that's usually progressive in the fact that it develops because of atherosclerosis or fat buildup or fatty-like substance buildup into the coronary artery that supplies blood directly to the layers of the heart tissue. In this diagram here, you see what's a typical infarct. An infarct is the heart attack that we were talking about, and this diagram here just gives you an example of that fatty buildup that can actually be a plaque within the walls of a normal healthy artery versus a diseased artery. You can see the restriction of blood flow is greatly pronounced. And here we're showing when somebody has atherosclerosis or arteriosclerosis, this fatty buildup, it's more likely that they can form a clot, and then a clot can eventually block the artery, and that's one of the reasons why somebody would have a myocardial infarction, otherwise known as a heart attack. Endocarditis is typically inflammation of the inner layer of the heart. Hypertensive heart disease is when somebody has high blood pressure that is impacting the heart's function. Mitral valve prolapse, or MVP, is when the mitral valve is not closing at the proper pace and with the proper restriction. A murmur is an extra heartbeat sound or sounds heard between normal beats. Pericarditis is inflammation of the outer layer or that double-folded layer of the heart. Rheumatic heart disease is usually caused by rheumatic fever, and it usually causes permanent destruction within the heart, such as mitral stenosis or other types of valvular damage. An aneurysm, we talked about this in the nervous system where you have a weakness in a local blood vessel. As it relates to this system is an aortic aneurysm that can also rupture, and if it does rupture, the person bleeds out within minutes. They would have to be on their way to the hospital and going directly to the ER as soon as it ruptures to actually support or sustain life. It's a very serious medical emergency. Deep vein thrombosis is when we have a blood clot that affects one of the larger veins in the lower limbs. Hypertension is high blood pressure. Raynaud's disease is an interesting condition where people have episodes of cyanosis, usually of their fingertips or of their toes, and it will pass as quickly as it comes on. Different things like stress, caffeine induction, smoking, and different types of things can contribute to the exacerbation. Varicose veins are typically abnormally swollen, twisted veins located in the legs, but they can occur in other places. There's an example of somebody with a very poor circulated or reduced circulation. This is an example of somebody with a serious implication affecting varicose veins. You can see how the varicose veins swell versus how the normal veins. There is some surgical means that they can do, but it's not often done without surgical intervention. You can have superficial or spider veins that are sometimes treated by injections, but the risk with somebody with varicose veins is thrombophlebitis, where they have that permanent inflammation, and sometimes they actually go in and inject and close off some of these veins that are causing the problematic areas. In the study section, I encourage you to go through some of the typical terms that you'll see here that relate to the cardiovascular system. In terms of laboratory procedures or tests, Here are some common laboratory tests or procedures that I encourage you again to look over as you review and prepare for the test on this system. Thank you.